Good morning. My name is Jim Levy. I'm your invigilator for the OET speaking test conducting on the 15th of January 2021. Can you say your name for the record, please?
Good morning, Jim. My name is Stanagadon.
And what is your candidate number, please?
My candidate number is 217241430.
Thank you. And you are taking this test as a nurse. Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Yes, sure.
The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
Many times, when people hear the word addiction, they think of the abuse of prescription drugs. What are some other addictions you have worked with?
I have actually spent some time working with clients with gambling addictions. It is really quite devastating to see the effect that lack of control over this addiction can bring to the lives of those who are addicted. I once had a client who lost his family's home because he used the deed for the home to fund his gambling addiction, and he lost it all. When he finally hit rock bottom, he checked himself into rehab so that he could be separated from any triggers and start to learn some coping mechanisms.
What is one of your weaknesses, and what do you do to help address/resolve it?
My biggest weakness has to be that I take on too many projects at once. While being involved and participating in various things is fun and can be good for a person, I tend to take on several things and then leave some projects unfinished. I have begun to limit myself to only taking on a few projects at a time so that I can devote the necessary time to staying on task.
How long have you been a nurse?
I've been a nurse since 1976. I worked as a floor nurse initially and then went to Mount Carlos Hospital. There I enrolled in a 9-month OR training program that included high-volume trauma, heart surgery, and neurosurgical cases. It basically changed my nursing career. I knew instantly that was where I belonged. I had worked at the city hospital as a volunteer when I was in high school, so it was an easy decision to move when I was recruited 10 years ago.
How would you rate your organizational skills?
Overall, I'm a very organized person, particularly at work. I consider staying organized both at the desk and away from it to be a critical part of doing an excellent job in any line of work. Planners, sticky notes and folders are all a part of my normal workday organization, and they all play a part in helping me to ensure that I don't let a single patient detail slip through the cracks while I'm taking care of my many workday duties.
What personal qualities do you have that make you a good perioperative nurse?
A couple of my best qualities that make me an excellent nurse are that I am caring and sympathetic. I have always had an innate ability to empathize with others. This, combined with my good judgment and ability to follow instructions precisely and give orders to others, has served me well in the operating and recovery rooms. I am also very detail-oriented, which allows me to monitor instruments and supplies to keep the environment safe and comfortable.
Great. Thank you very much for sharing that. So, let's move on to the role plays now. I'll take the part of the patients, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. Now you can start your role play. Don't worry if I stop the role play when the time is up.
Good evening. I'm Stanagadon, head nurse in charge today.
Good evening, nurse.
How are you feeling today, Jim?
Thank you for asking. Nurse, I feel better but have some pain.
I can understand your situation. Pain is quite natural. It's just a few hours past the surgery, right?
Yes, I know.
Don't worry, your pain will subside.
Yeah, it may. But how to get rid of this pain completely?
I know you are quite upset. But there is nothing to be alarmed about the pain. It will decrease gradually.
All right. Now, shall I get some tablets for pain?
Yes, don't worry. The doctor has prescribed some painkillers, which you will have to take for a couple of weeks.
Thank you. But I want to speed up the process of healing. Can you tell me what I can do for that?
Yes, I appreciate your concern. The only way that you can get a faster recovery is through following a proper medical regimen and adequate rest. However, it will take time, and you need to be patient.
Okay, is there any diet pattern I have to follow?
Yes, I am glad to explain it to you. Initially, start with clear liquids today, to prevent nausea, vomiting and constipation. Soup, jello, juices, popsicles, and carbonated beverages. Then, advance to a regular low-fat diet.
Do I want to reduce the quantity of food?
Eat smaller meals more often instead of fewer larger meals.
Okay. By what time I may be able to get back to my normal diet?
You can eat a normal diet, but avoid eating fatty food for about 1 month. Fatty foods include hamburgers, whole milk, cheese and many snack foods. If your stomach is upset, try bland, low-fat foods like plain rice, boiled chicken, toast and yogurt.
All right. I understand.
Since doctor has not specified about drinking water, you should drink plenty of fluids.
Is there any chance of getting my stomach upset?
Yes, there are chances. If you have diarrhea, try avoiding spicy foods, dairy products, fatty foods and alcohol. If the diarrhea continues for more than 2 weeks, talk to your doctor.
Oh, I see.
However, eat lots of whole grains, fruits, green leafy vegetables. Avoid foods that cause constipation such as dairy products, red meat, processed foods such as pizza, frozen dinners, pasta, and sugar products such as cakes, pies, pastries, donuts and drinks containing caffeine.
Oh, God. Nurse, what about my daily activities?
Rest for the next 24 hours. No strenuous activity for 2 weeks. No heavy lifting for 2 weeks.
And what do you think, nurse, about how much time I will take to recover from this?
Well, it depends on you. Normally, patients recover after a week or 2. It all depends a lot on the way you take care of yourself.
Okay.
No alcohol for 24 hours after surgery, and no driving while taking pain medicine. You should have a responsible adult with you for the rest of the day and night.
Sure, nurse. My mother will be accompanying me till I get full recovery.
All right, that's good to hear. Nothing can replace a mother's care. But, just for your information, we will also provide a home nurse upon your request.
That sounds good. Nurse, is there anything I should keep in mind?
Yes. You may experience some abnormalities like right shoulder discomfort, chest tightness, bilateral shoulder discomfort for 24 to 48 hours after surgery. Gradually this will go away. It is caused by carbon dioxide used to inflate your abdomen during the procedure. Carbon dioxide is a gas, and like all gases, travels upwards, settling on your chest and shoulders. Soreness in the abdominal area, similar to an ache, you would feel after starting a new exercise program, involving your abdominal muscles. This ache will gradually go away within a few days. Your abdomen may be distended for a few days after surgery. There may be a large black, or blue area, bruise, on your abdomen to your hip. This may appear within the first week after surgery. It is caused by blood pooling under the skin from your surgery. Your body will reabsorb this blood over time. The bruise will turn yellow and disappear in time. So, don't panic if you notice any abnormalities. Contact us, and clear your queries time to time.
Alright.
You should listen to the doctor and should follow instructions without any failure.
Definitely, I will follow everything because I need a faster recovery.
Good.
Is there anything that I need to follow after discharge?
Yes, you should avoid taking a shower for the first 2 weeks.
Okay, that's fine, I will take care of it.
Okay, I hope that the information that I gave you is clear.
Yes, it's clear and I will follow the suggestions and advice that you provided me.
Is there anything that I need to answer for you?
No, not for now. Thank you.
Alright, I'll explain the medications once the doctor has prescribed it for you.
Oh, that is nice, thank you.
Alright, I will see you soon. If you need anything you can press the bell on your right hand side. Any of our nurses will come and assist you.
Yay, thank you.
You are welcome. Have a speedy recovery.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.